In our top story this hour, President Cyril Ramaphosa has signed the Presidential Health Compact at the Dr. George Mokhari Hospital in Ga-Rankuwa outside Pretoria.
The compact is government's commitment to bringing better healthcare to all South African citizens.
Our mission is to reform healthcare, to make it better suited to the needs of an ever-growing population. We want to ensure that it becomes part of our movement forward towards equitable healthcare and to give our people the best access to healthcare. The targets set under Goal 3, ensuring healthy lives and promoting well-being for all ages, mirror the aspirations of the National Development Plan. To give practical expression to Section 27 of our Bill of Rights, which affirms the right of everyone to have access to healthcare services, including reproductive healthcare, the NDP sets out specific goals, priorities, and actions towards achieving a healthcare system that works for everyone. Ensuring positive outcomes by raising life expectancy, reducing the burden of disease and reducing mortality is so much more than a health issue. A healthy nation is a successful nation. The transformation and effective resourcing of our health system is fundamental to our plans for building a just, equitable, and prosperous society. A healthy population is economically productive. It is a nation that is industrious and is the bedrock of any country's economic development.
All right, and to get a clearer understanding on this issue, we are now joined in our studios by Dr. Angela Coetzee. She is the South African Medical Association's chairperson. Doc, good afternoon to you. Thank you so much for coming through.
Thank you. It's a pleasure, and good afternoon to all the listeners out there.
So finally, the compact has been signed. I know that there were delays. It was supposed to have been signed in November last year.
No, it was supposed to be signed earlier this year in around about April. But then it was postponed because all of the information that was needed was still a bit lacking, and they were also waiting to see what the cabinet announcements would have been.
I know that you're one of the people who were saying that the deadline was very unrealistic, that it wasn't going to be achieved well in time.
Yes,
yeah.
Yes, but now finally it is 9 months later, so it's like a new birth.
Yeah, it is indeed. So this plan is as a result of the summit that took place in October last year. But just tell us more, make us understand. What does the compact plan entail?
Let me try to make it as simple as possible. So last year, there was a group of unhappy family practitioners, doctors, mostly from the previous Mkhonto Sizwe doctors. One of them was Dr. Faisal Randera and Dr. Aslam. They were very unhappy with the way that healthcare is going to, the direction it took. They sat with the then president, or our current president, and they asked, please can we have a health summit where we can voice our concerns regarding what is happening in the public sector. So this summit was held, and then afterwards, a committee was being established, steering committee, to look at all the different pillars. We call it pillars because it is HR, it is to do with IT, it's the health pillar. Health pillar is pillar number 5, of which the South African Medical Association took the lead in, but we have more than 130 constituencies behind us, and we all then said, what can we do from pillar 5 to make healthcare better? So it is a collaboration of private sector, state sector, government, and individuals out there, civil society, and we raised our voices and we said, this is what is happening, we have to make a plan. So then there was a lot of work being done in this field, And we came up with to say, from the healthcare sector, remember there's still other sectors as well, or pillars as well. This is what we want, and we want to have access to for our people into healthcare. We would not want stockouts. We do not want to have patients sitting the whole day, not to be able to see a doctor. We want personnel to be friendly towards the patients, to understand. And timelines was given, and this is where we are. So today we signed this compact, and now the work is going to start. All the things that we think we would like to have, and making our healthcare better for everyone of us in the public sector. This is now going to start to happen. And accountability, there's a political willingness to do this. So we have to work on this.
All right. So basically the plan will improve on services that are rendered to our people, mostly at your public facilities.
Yes.
But how are you looking at, doing this? Because I know there are a number of concerns really at public institutions. Shortages of health professionals is one issue of concern. So what exactly have you identified the challenges and the problems that you need to address?
Yes, I think we have identified them. It's all been part of the compact document. And at the back of the document, you will get the timelines and the suggestions that we made, and the ways that we think that we can better this healthcare system as a collective. What happened in the past is that government would try to better healthcare on their own. It's a siloed approach, and now it is the workers as well. It is the
all
doctors,
the stakeholders coming
all the
together.
stakeholders now coming together for the first time, and so. Let's go together. Let's make this work. Let's do it. So you cannot expect the current system to give universal healthcare to all our people. Primary healthcare is so important. And if we can get that right under the NHI funding model, that will help us along to get healthcare that we deserve for our people out there.
Yeah, that's an important point that you bring in there, Doc, because I wanted you to sort of make us understand, because we also have this NHI that is also aimed at improving health services. So how are the two going to work? Are they going to complement one another?
Yes, the one cannot be without the other one. And I think there will be now a drive to make the term NHI much more understandable. NHI is a funding model. It is to say there is X amount of monies, but NHI is not going to give us the quality outcomes that we need in the public sector. It's not telling us that part. It's giving us the money. And it's how we're going to apply that money. How we're going to prevent waste, fraud, abuse, corruption, to get this healthcare system back onto track. You have to remember that the current private sector, medical schemes, the fees there are getting higher and higher, increasing every year. The ordinary average South African cannot afford it. Within 5 years from now on, we will not be able, again, the average South African, be able to afford a comprehensive private healthcare package. So if we can't get our primary healthcare via the public sector going, we're all going to be in trouble. So we have to make sure this works. So the compact is how to get universal health coverage so that we can all have coverage for day-to-day diseases and illnesses, and as well as primary health care going, because if you can get it right on primary health care, your tertiary costs will come down.
They will, yes, indeed. And really, this is a beautiful initiative, listening to the way you explain it to us. And lots of concerns that come from South Africans is that we've got beautiful plans, we've got beautiful policies on a piece of paper, but the implementation part of is what still remains a challenge for us. So you spoke about accountability earlier. I just want to get an understanding as to how will this plan be tracked to ensure that there's sustainability, but most importantly, efficiency.
Yes, you're so right. That is one of the points as well that has been identified by this, one of the pillar streams. So since we have signed today, the work will start from next week. So we identified the problems and the issues with timelines. Then there were, let's say it is a problem in giving quality primary healthcare, in training community workers. Then there were a group that said we will help and give our time, or we will give input in how to train these people. We will walk the talk with the government, so that then from next week on we will say, okay, you identified that you can give input in this area. Let's start to implement it. So the implementation phase is really a very important phase, as you correctly said. So there will be another team making sure, reporting to the president, reporting to another committee, the steering committee, to make sure that it is actually being implemented. And again, it's a collaboration from the private and the public sector. So it's not...
So progress will be tracked to see how far the plan is.
Yes, and civil society is involved. And as I've said, private individuals are involved. So it becomes more difficult now to hide behind, it's a public sector thing, there was not money, or this happened, or that happened. The eyes will be on all of us to make this work, and we have to make it work.
Yeah, of course, as you said, you're starting with this plan as soon as next week, but when are we likely to start seeing changes? I know challenges have been going on for quite some time now. It's not going to be an easy job, but are we likely to see changes anytime soon?
Yes, the shortest times of implementation timelines that were given from some of the willing participants were 6 months. So there's some low-hanging fruits that one can easily try to get better. But we've got up to 5 years to get this perfectly going. So yes, and we will stumble. It's not all going to be
a smooth ride.
Ride. But we are willing to work together. This is the first time that the Department of Health is also willing to work with the private sector. And by forming public-private sector initiatives, I think we can get a long way. Not everything is also good into the private sector, but we must.
Indeed. Well, Doc, we'll have you back in studio in a few months' time just to really look at the progress that's been attained. Thank you so much for coming.
Thank you so much.
Baie dankie, ons waardeer dit.
Baie dankie.
Well, there you have it, Dr. Angelique Coetzee. She is the South African Medical Association's chairperson, really breaking this health compact plan down for us, bringing us to an understanding as to how we will all benefit as South Africans.